Okay, hello everyone. Today I'll be discussing one of the most difficult responsibilities in healthcare, and that is communicating bad news to patients. I'm going to be using the article Communicating Bad News to Your Patients by Dr. John Old as my primary reference, and I'll present a realistic clinical scenario that demonstrates how healthcare professionals can communicate difficult news ethically, compassionately, and professionally. So first, why the conversation is hard. Well, receiving bad news can completely change how a patient sees their future. And because of that, health professionals face several challenges at the same time. Um, they must tell the truth honestly while still preserving hope, and they also have to respond to strong emotions such as fear, sadness, and anger. And they have to respect the patient's culture values and family dynamics. And they have to communicate clearly without giving false reassurance. According to Old, that the way bad news is delivered can have a lasting impact on how patients cope with their diagnosis. So we're going to start with the clinical scenario. So we're going to consider a hypothetical case. Maria is a 52-year-old Spanish-speaking woman who's recently underwent a colon biopsy after experiencing rectal bleeding and weight loss. The results confirm colon cancer with lymph node involvement. Before the appointment, Maria's daughter asked the physician to tell her the diagnosis first and not tell her mother immediately. So this creates an ethical dilemma because although family involvement is important, Maria has never said that she wants her daughter to receive medical information before she does. So respecting Maria's autonomy means the physician must first determine her preferences. So we're going to talk about the 6-step approach. To manage this difficult conversation, the physician follows the 6-step communication approach described in the article. This structured process helps deliver bad news honestly while maintaining compassion and respect for the patient's dignity. So steps 1 and 2 is assessing and understanding the patient. So he asked, Maria, before we talk about the results, can you tell me what you understand so far about why we performed the biopsy? And after listening carefully, he prepares her for the news by saying, I'm afraid the results are more serious than we hoped. So is it okay if we talk about them now? So there's like a warning shot, and it allows the patient to prepare emotionally before hearing the diagnosis. For steps 3 and 4, we have first, the physician delivers the diagnosis clearly and compassionately, and will says that they found cancer in her colon and that it has spread to nearby lymph nodes. And because this is a serious diagnosis, there are treatment options available. And he avoids complicated medical terminology. Um, if Maria begins to cry, so he responds with empathy and says that this is frightening, but I'm gonna stay with you, and we will go through this together. And he allows silence and acknowledging emotions to help the patient feel supported instead of abandoned. For steps 5 and 6, we once Maria has had time to process the news, the physician asks how much information she would like to receive. He explains the available treatment options, answers her questions honestly, and asks whether she would like her daughter to join the discussion. Finally, he establishes a follow-up plan by arranging an oncology appointment without 48 hours, which provides written information in Spanish and connects with our nurse navigator and scheduling another visit. Sorry. This reassures Maria that although the diagnosis is serious, she will continue receiving care and support. So for my ethical reflection, this scenario demonstrates that the 4 main principles of biomedical ethics. First, it respects autonomy because it allows Maria to decide how information is shared and who participates in her care. It also demonstrates beneficence by providing emotional support and helping her access treatment. It follows non-maleficence by communicating the diagnosis in a way that minimizes unnecessary emotional harm. And finally, it respects cultural values by recognizing the importance of family and language while still protecting Maria's right to make her own decisions. So as Dr. Old reminds us, communicating bad news is not simply about giving information, it is about caring for the patient while telling the truth. Compassion doesn't hide the truth, it makes the truth easier to face. So here are my references, and one sentence to remember: there is always something we can do to care. Thank you so much for your attention.